Diabetes. Next on diabetes. It is a confirmed risk for developing dementia in later life. So the brain cells in a person with diabetes, over time the brain cells become immune to the effects of the insulin, which then leads to an abnormal buildup of the amyloid plaques and tau that build up in the brain naturally, but they over build up. And it's the build-up of amyloid plaques and taus which is one of the main contributors of Alzheimer's, or contributors to Alzheimer's disease, type of dementia. That's both types of diabetes, type 1 and type 2. And the thing is that if you've got diabetes, you're likely to have, or you could have, high blood pressure, high cholesterol, and some form of obesity. All those things now compounded with diabetes unfortunately does add to your risks of developing dementia. It's not a guarantee, it just adds to your odds of developing it in your brain. And the way round it, I'm guessing, or the only thing you can do really is just to keep having a balanced diet, so have a balanced diet before you get diabetes. That's a positive plus for anyone, teens right up to their age 70, anyway, regardless of whether you've got obesity or diabetes, high cholesterol, high blood pressure, any of those things. Always a balanced diet is going to help steer you away from those, any one of those. And if you have a multitude of those, then obviously a balanced diet is going to help lessen your chances of those adding to the risk of you getting dementia. So just look at that really, I suppose. When I was at college, I remember passing out one evening and falling down these stone stairs, and I sort of woke up in the hospital, and the doctors that was there said, well, we haven't found anything particularly wrong with you other than your blood sugar levels are really high. I said, well, that ain't surprising, because we used to just spend all day drinking coffee and eating Mars bars. That's literally because we were studying so much to try and get all the plant names right, and well, it was a horticultural college I was at, and then we just didn't sleep or eat properly or anything. Hardly ever went down for breakfast. We just had literally cakes and Mars bars, chocolate bars, and coffee. That's what kept us going, and as a consequence of that, obviously my sugar levels got to a tipping point and it just flaked me out, but I was sort of, it did worry me, from that moment onwards. Then I didn't have any sugar in tea and coffee. I still have chocolate and cakes, but just didn't have the sugar in the tea and the coffee, so I did help myself a little bit, but did that have an effect on me getting dementia in later life? I don't know. All I can say is that the data suggests that yes, that did have a slight effect on me. So I'd probably give myself half a point for diabetes. And it's sometimes actually unofficially known, Alzheimer's disease is sometimes unofficially known as type 3 diabetes, or has been known in the past. Type 3 diabetes is Alzheimer's.